It's not about patient care anymore. It's about dollars from pretty much all angles of the system right now. And that's really frustrating for patients. It isn't to say that insurance doesn't have a role. Having some kind of catastrophic insurance plan makes sense for that scenario. The problem is it's intentionally complicated, so we don't really know what we're getting. So there's ways to pair things with that catastrophic plan to get really good care and save a lot of money. And we in direct primary care think we're a helpful solution for that.
Today, we're here with Matthew Simone of Homesteady Health. Matt has been in healthcare for over 25 years, the last 19 of which have been as a nurse practitioner. Family practice trained, he has cared for patients in the Alaskan bush, in fast-paced urban trauma and ER environments, in clinical leadership roles with startup urgent care groups, and most recently in his own private practice, Homesteady Healthcare, direct primary care, here in Ithaca. Matt serves on the board of the Nurse Practitioner Association of New York State Region 2, where he has served as president in the past, and he was named Nurse Practitioner of the Year for 2025. Congratulations and welcome, Matt.
Yeah, thank you so much for having me. It's a real honor to be here on what is going to be maybe your earlier episodes, and congrats for launching something new and different and giving us in Ithaca some insight into the local economy and all the great businesses that are out there. So I appreciate having the opportunity to come on today and chat.
Great. Well, thank you so much. So let's just start right off the bat here with what you're doing. So most people, when they do healthcare, they have health insurance, right? And they go to the doctor, they pay a monthly fee, whatever it is, hundreds or maybe now thousands of dollars a month. And then they go to the doctor and they have a copay and they have a deductible that they have to meet before insurance kicks in. This is what we're at right now. And then there's surprise bills sometimes too, right? This is sort of the standard model. Now you're a little bit different. You do direct primary care. So tell us a little bit about what that is.
Yeah, so direct primary care is a model that's been around for quite a while, actually, but and has been a proven way to get excellent health care. But it's really taken off a lot more recently as people become more and more frustrated with the insurance system and corporatized medicine. As you even kind of just described right there, insurance is just incredibly complicated and very difficult to navigate, and nobody really knows what they're paying or how it all works, to be perfectly honest. Sometimes your employer is paying for a lot of it. You might not even realize that a big chunk of it's coming out of your paycheck. So yeah, you pay this high premium every month and you think you're covered, and then there's all these other crazy costs that come in, and if you're not well versed on that you can get blindsided by a lot of it. So direct primary care kind of cuts through all that nonsense. You pay one low monthly membership fee, almost like a gym membership. In my case here, my practice, it just kind of pulls out like that out of either a bank account or a credit card, and we never really talk about money again. There's no additional costs. There's no additional co-pays or co-insurance or deductibles. You just get that high quality care, and with direct primary care, it's approximately 80 to 90% of your healthcare needs are all covered in that very low monthly membership fee. With the 60-second elevator pitch is essentially that money comes out and you get unprecedented access to me as your provider. So what does that mean? That's essentially same or next day appointments are guaranteed. Appointments are as long as you need them to be. It's really unlimited visits in a month. And you can text me directly, call me directly. Once we build that relationship, and sometimes it's a little heavy up front on the intake process, really getting to know and building that relationship with my patients, everything gets easy from there. And it's a very convenient way to access your care and very affordable when you think about it in comparison to the system. So it's really a great way to get care. And in my practice, that includes all of your primary care, all of your urgent care needs, all of your sort of lifestyle management and guidance. So it's really offers quite a bit compared to what you might get trying to navigate the system.
Wow, that's great. So absolutely unlimited. If I needed to see you every day because I was really sick, that would be covered?
Yeah, absolutely. So I use the Netflix analogy as sometimes an easier way to do it because we all have these streaming services. Money comes out each month, right? Some months you're going to watch a ton of movies. Some months are going to go by and you're not going to watch any movies at all. But when you press play and you want that movie to come on, it does. And it's the same way with this here. When you need that healthcare, we're there for you.
That's great. Well, so what happens if there's an emergency or I need lab tests, for instance?
Well, there's a couple different scenarios. So we'll start with the first one. Emergencies, I'm not an emergency room, right? So, I encourage my patients, if you have a true emergency and you're confident that's what it is, call 911, get there right away. Don't waste time chatting with me. Um, However, I do have an emergency background and an urgent care background, so there are a lot of things that I can do for my patients that might save them a trip to the emergency room. So for any of that on the fence stuff, even after hours, I encourage my patients to call me and we can kind of talk through it. If it's something that I can manage, it might be actually, that's not that big of a deal. Let's get you on the schedule in the morning. I got an opening at 9:30. We'll see you then. It might be we're on a telemedicine call and I can resolve that problem right there on the spot and save them a trip to the emergency room. So that's a big part of the savings that come with this that people don't really think about, is like it's saving you costs by not having to go to the emergency room unnecessarily, not having to have those needs addressed. Some people use the emergency room for all their primary care needs, which is a big challenge for the whole system, and all that just sort of goes away with this. So from the emergency perspective, that's how that would work. When you talk about things like labs, I should say that probably 75% of my patients have insurance to some degree. A lot of them are on high deductible plans, so this is a cheaper way to do it. Some people have HSAs, which you can use your HSA dollars to pay for this monthly service, which is a great way to do it. And then in that case, the insurance would be utilized for things like labs and medications and things like that. So if you're already paying into something, we try to use it as much as we can to continue to save you money. In the cases where they don't have insurance, I can offer much cheaper services than what you would actually be paying through your insurance. So very cost-controlled labs that are insanely cheap compared to what the system would charge you. Maybe a full workup might cost $1,100 or $1,200 using your insurance through Quest. Maybe they cover it. Maybe you have to be responsible for some of that. That same package costs about $130 with me. So there's huge savings there. We can find ways to get discounted medications, discounted services for imaging, for example, working with private imaging centers that are outside of the system, or at least operate with cash pay prices. And oftentimes, again, they're cheaper than what you'd be paying through the system. So
Right.
it's a great alternative. It doesn't have a solution to every single problem, but we're always hunting for ways to help my patients navigate the system and save money where they can.
Yeah. Full disclosure, I do have a DPC physician as well. She's based out of
Oh, that's
Syracuse.
amazing.
Yeah. And I've been with her
Working
for a number of
happy with her
years.
care?
It's
Yeah.
been wonderful. Yeah. One of the things that I was really shocked to learn is that you can get tests like an MRI or something and pay out of pocket, and they're not that expensive. When you see the insurance bills, they're always in the thousands of dollars. But if you pay out of pocket, they're maybe just a couple of hundred. It's not, it's really much more reasonable.
Yeah, that's actually a great example of how this can work. I had a patient that was struggling to navigate with the system and felt like his problem was misdiagnosed, needed an MRI, or at least thought he needed an MRI, and it was ordered by the provider, but the insurance wouldn't pay for it, and they
Mm.
wouldn't authorize a prior authorization. So he went a long time with what we believe was the not the correct diagnosis. We were able to get an MRI for like $400 or $500 and get that diagnosis like immediately. Yes, this is what I suspected was going on, but not what he was getting care for. They wanted to do surgery on him.
Mm.
Once we got the diagnosis right with the MRI, we were able to get him some physical therapy and back on his feet. And as far as I know, that problem's resolved. So that's a
Yeah.
great example about how the barriers to access can sometimes be problematic for a patient
And I think
to
that's, yeah,
navigate.
I think it's really important for people to remember too, that insurance is often really a barrier these days, right? They say no to so many different things that the provider and the patient want, and yet they're just sending up roadblocks because they don't want to pay for it. So we might have this mindset that insurance is going to save us. It's going to cover things, cover those big expenses. But then we hear all these horror stories about people needing actual care and and just getting denied left and right for it. I don't know if that happens
Yeah,
so much here,
it's
but
really unfortunately where we're kind of at with things. It's not about patient care anymore. It's about dollars from pretty much all angles of the system right now, and that's really frustrating for patients. It isn't to say that insurance doesn't have a role. Having some kind of catastrophic insurance plan, whether that's insurance based or health sharing, which is another option I talk about with folks, is probably a good thing to have. And that's what insurance was designed for when it became a thing, right? To help you in these catastrophic scenarios where a cancer diagnosis or a car accident is going to keep you hospitalized or excessive bills for long periods of time. Makes sense for that scenario. The problem is it's been legislated into every aspect of it. So now you have a middleman controlling and dictating sort of all aspects of your care. So we all sort of have the responsibility of trying to figure out what's going to work best for us in our financial situation. But the guidebook for that doesn't really exist, and it's intentionally complicated, so we don't really know what we're getting. So there's ways to pair things with that catastrophic plan to get really good care and save a lot of money. And we in direct primary care think we're a helpful solution for that.
yeah,
Alternative, I should say.
it does sound like a really great solution for a lot of people. Maybe not for everyone, but definitely something that people should look into if their health insurance has suddenly skyrocketed,
Right.
for instance, or they've lost
Yeah,
it
which
recently.
happens to be the case a lot this year. Yeah.
Yeah, exactly. So you've been practicing in Ithaca for 5 years now. Is that right? About 5 years?
Yeah, that's correct. Yep. Moved up here from Philadelphia. We had planned to move up here before the pandemic, but the pandemic sort of expedited, as it did for a lot of people, some pretty dramatic life changes. So, it took us a little while to get our roots here, and I was working a few different jobs, all with the intention of kind of figuring out what kind of practice I wanted to open. So I was doing several different jobs, sort of test driving some different things that I liked in my career and say, well, can I put that as a part of my practice? And did that for a few years. And now I've been open as Homesteady Health for 2+ years now or so, give or take, maybe a little bit more. I've been I started out sort of, out of my house, so I was doing things from there. So I've been in the office for probably around 2 years now. So,
Well,
and it's great. All those other jobs really helped inform the way I wanted to have my own practice and the way I wanted to do things differently. And I've been in healthcare for a long time. I've watched it sort of decline, and dramatic changes over the course of my career that were not just bad for patients, but really tough for providers and for nursing staff and for everybody involved. So I really wanted to start something that got away from a lot of those challenges and got back to why I, wanted to have a career in medicine.
so how is this different for you as a practitioner? And do you think that the direct primary care model is something that more practitioners will be moving towards, or if
I mean, I think it's a no-brainer personally. I mean, honestly, I'd been burnt out from healthcare several times over from some of the different challenges in my career. That stuff's all pretty well documented, so I'm not going to get into details there. But, there would be places and times where, where I was in urgent care seeing 70, 80 patients in a day. Like, that's insanity, no breaks.
it's a lot, yeah.
I'm not really present for some parts of that, or my patients are not given the time to really explain what's going on with them for me to help figure it out, And so I kind of came move up here thinking I'd open a cheese shop or something. I was done with medicine, it just wasn't a great place to practice anymore. And providers are being squeezed on so many different angles. It feels like we're just the machine and patients are just the widgets. And the more widgets you can get through the machine on any given day, the better it's often. There's all these metrics around it to make sure that you're passing as many widgets as possible. It's just been very corporatized and very industrialized, and it's really not about patient care anymore. And I just didn't want to be a part of that. So When I kind of heard about direct primary care, it just sounded like such a solution to all my challenges. I mean, one, I could get back to being myself again and being able to spend time with patients and really have not just the time, but the mental energy to really digest what they were bringing into the office space and to have time to kind of sort through complex problems and really give them the opportunity to feel heard that the system doesn't offer anymore, right? So for me, it's brought back my passion for caring for people, which
Oh,
was
that's
all
great.
but dead, which is really an exciting thing. So I feel like when I'm here every day, I'm excited to be here and my patients get the best of me every day. And it allows me to have the life that I want, which is a very active life, which is raising two kids, which is being a family man and being a strong present member of my community. And that is really difficult to do in modern medicine, not just for providers, but for anybody out there that is kind of sacrificing a big part of who they are for other people. So we've gotten away from that being rewarded, and this sort of gives that to me in a lot of different ways. So my patients get better care. I'm a better provider. It's a no-brainer.
Is there anything that you miss? It sounds like it's just a much better situation, but
Yeah, I'd say the only thing I miss is the team. I've been in ERs and traumas and places where, even in urgent care, where you have a great team that's really necessary to provide the best care, and working together and bringing like all kinds of diverse skill sets from your techs all the way up to your surgeons. That would probably be the only thing that I miss about it. I really enjoy that. I am kind of a people person, so I like that camaraderie. Like we've got a difficult challenge. How are we going to come together to meet that challenge and take care of our patients? And that was always rewarding. I hope to build my practice to someday get back to something similar to that. But for now, it's me and my patients. And I happen to work in a place with other providers that have shared office spaces. And so I get a little bit of that. We've got like a multidisciplinary sort of approach to care. We're all separate providers, but we can sort of refer to each other and bounce ideas off each other. There's some alternative practices in here too, which I find very valuable to my patients' care. So I get some of that, but yeah, I do miss that part of it.
that's great. If you were talking to somebody who was burned out and wanted to start this, how hard is it to start their own primary care practice or to join another? I don't know, join another one.
Well, it's I would think that in some ways it's not as hard as you think, right? So a lot of the barriers that people have, like the mechanics of starting something, are not that difficult. You do have to have the right mentality. You do have to have like sort of a fair amount of financial runway in some ways, at least some money saved or good family support or whatever the case may be to be able to weather the storm. If you're savvy about it, you keep your overhead really low, and you don't really need a lot of capital. I had nothing to start this with, just a little bit of, probably 10K, which isn't a ton of capital to start. I realize some people don't have that, but the way you can sort of bootstrap it and piece it together, that really tunes well to direct primary care versus say something like urgent care where you need $1 million to get a building up and running.
Right.
So there are a lot of ways to do it. I think the biggest barrier is probably just doing it. And for me, like that was sort of my challenge, having some savvy in the startup world and some experience from some of the past places that I've worked for. I felt like I could do it. So the confidence part wasn't there, but it was like, what do I want to do? And that was holding me back for a long time. And eventually I'm just like, well, this seems good. I'm going to just start this and figure it out from there, build the plane as you fly it, so to speak. Address the needs of the community as they come, and that's how it's kind of been. So I've got the direct primary care practice, but other things have spoken to me. The community has, sort of asked for certain things, and I'm meeting that with the other services that I'm offering. So,
Oh, so what else are
you
you
just
offering?
kind of do it.
Yeah. What are some of the services that you offer through your practice or externally?
Well, one of my favorite things about the practice is I do a lot of men's health work, and part of that is testosterone replacement therapy, where there's a lot of men that aren't really getting their needs addressed by the system, and and the treatment can be life changing. So that's really rewarding. Along the same lines, I've had a lot of women asking for hormonal therapy as well, as they go through the different challenging aspects of midlife, for example, perimenopause, menopause, and the landscape has changed dramatically around that. And the system hasn't really caught up to it quite yet. So that was like, well, this is the need. My patients are telling me they want it. Let me figure out how to offer it and deliver that care at a high quality. So those are some big examples. One big thing that's probably worth mentioning for this podcast is trying to meet the needs of employers that really want to take care of their employees and offer them health benefits. But the reality for a small business is that the insurance landscape is really, that's not a sustainable thing for their model. Most people, it's not in the budget. So, we just see a lot of workers out there that don't have any kind of healthcare benefits and are kind of left on their own. So I've offered models that all the services I offer for direct primary care to employers on a per employee per month basis that's, sort of volume based, cheaper than my normal rates to be able to offer something to their team. So maybe it's not a full spectrum of care, but 80 to 90% of their needs could be covered. And, you're offering something to your employees that is a whole lot better than nothing. I think it's a great, way to get care. So, and I think I'm a pretty good provider. So I know I'm offering that kind of stuff to folks.
That's fantastic. Yeah.
Yeah. So from the employer perspective, they're getting patients back to work faster when they're sick. They're preventing chronic disease that might keep somebody out for a long period of time. They're, now sort of separating themselves in the recruitment marketplace by offering something that really a lot of other industries don't offer, especially if you're in like the service industry or the trades, or artists and things of that nature, where most of these folks just don't have coverage and they deal with all those consequences. So at least we can get 80 to 90% of their needs met at a very reasonable price point.
Wow, that's amazing. We've got so many people in the service industry here in Ithaca that I'm sure don't have health insurance, and the employers certainly can't afford what it is today. So, and what strikes me about your model and the direct primary care model, and especially the way that you're practicing, is you just sound like an old-fashioned kind of country doctor.
Yeah, that's funny you mentioned that. I mean, when I was early in my career, before I was even a nurse practitioner, I had the opportunities to work in some of those places out in Montana and Alaska, and I was really drawn to that kind of care. Some people don't like to be that close to their patients in the sense of like seeing them at the grocery store and things like that. And that has its challenges, but it's never really bothered me. I really enjoy being able to try to elevate my community in whatever way I can offer. And this is a skill set that I have to offer. So I was really privileged to have some exposure to some really amazing doctors and nurse practitioners that were doing this in small communities and really just being everything for them. And that always inspired me. And even when I was working out in the Alaskan bush, having the opportunity to do like home visits and really be in the patient space, really truly understand who they are and the environmental challenges that are sort of sculpting their sort of healthcare journey. And it just elevates my ability to provide care to them to a higher level. So that sort of stuff spoke to me when I came back to this. And I even do home visits as a part of my practice here. So I have a home visit exclusive sort of membership where those patients, I kind of go to their home for everything. They can't get into the clinic for one reason or another, or they choose not to. And, that is really rewarding me. I like to go do the first visit in the patient's home if they're regionally close enough and they're welcoming to that. And it just accelerates the relationship building process in a way that sometimes 15 office visits can't show you, So.
Right. Well, and that's what we want to do here on this podcast is help people to envision an economy that is more based in care, that is more, the economy that we've got right now that we're functioning under that isn't working for everyone is very much about slicing and dicing and selling the smallest pieces that we can to the highest bidder. And as a result, we end up with less good care sort of all around. And with your model, we're returning to the old-fashioned way, which is just a person offering care, a person who's needing care, and you meet and you do it. And it is kind of old-fashioned, but it's worked. It's worked for thousands of years, right?
What's so complicated about it? What's so complicated to me is like what other industry do you provide a service that you get paid by a third party months down the road if you even get paid at all? And if they can find any way to not pay you, you don't get paid. Like how is
Right.
that model supposed to work? So, and I don't blame providers. They're doing everything they can to keep the lights off, especially in primary care where it's not really incentivized in the way that other specialties are. So, they got to do all these different things just to make enough money to keep the lights on for their patients because they're just not getting paid in a way that makes any sense.
Right.
So why not return to something? I'm offering a service, you're willing to pay for it. Pretty straightforward. Seems like basic
Let's make it
capitalism,
simple.
you know
Right.
what
Right.
it should be, not what we've developed into.
Exactly. We're calling it the new economy. Of course, there's still money exchange. That's always going to be a thing, but it's not about selling everything for the highest profit. It's people over profit, right?
For sure. For sure. And I think people want to pay for things. They want to pay for service they value.
That's
Even
true.
in places where I've worked, where they have, like, around the world, where I've had the opportunity to engage healthcare, they want to provide something. They don't want it for free. If they've only got chickens or eggs or something in some of these communities, they want to provide that because they value your service, and that's really the way it should be.
Right. Yeah. As human beings, we're not takers. We want to give back as well. So having a good reciprocal relationship is so important. It's central to who we are as humans. And it's wonderful to see you here in Ithaca and doing this. I think it's just fantastic. If somebody wanted to follow up with you and maybe find out more about becoming a
Sure.
patient, what would they do?
Yeah, it's pretty straightforward. There's a lot of different ways actually. So I've got my website, which is homesteadyhealth.com, which is probably the easiest way to engage. And you could, submit an inquiry there. You could schedule a free meet and greet there. So anybody that is interested in the practice can schedule a free meet and greet with me in the office, or we could do it telemedicine wise. And really just get to know me and understand what the practice is. I have a newsletter that anybody can follow, and you can sign up for that on the website. And I put out some health information once a month, announcements, let them know what I'm doing in the community. We have Facebook and Instagram, which is a great way to sort of follow along what's going on. Or they could just call me at 607-882-6001. Right now, I'm pretty much a one-man show, so you're going to get me on the phone, and I'm going to get back to you as soon as I can, and that's reflective of the service that we offer. Again, I hope to build this to be a bigger, and get more people out of the system and working in a place that they're happy to do their job again. But, I'm still in the building process. It's going great, but we're, right now you're going to talk to me. So
Excellent. I love it.
pretty easy to do, I think.
I love
And
it.
if you've liked everything you heard, you can just go to the website and sign up, and I can get you in on your intake as early as next week.
Perfect. Okay, so that's homesteadyhealth.com, and the number is, what was the number again? Sorry.
607-882-6001. And it's Homesteady with a little Y in there, homesteadyhealth.com.
Homesteady Health. Very good. All right. Well, thank you so much again, Matt, for meeting with us, and I wish you all the best. I hope maybe we'll see you out in the community.
I'm out there. You can certainly see. I like to do different presentations. I try to get out and table at a lot of events. So if you ever see me out, don't hesitate to come up, say hi. And I really appreciate the opportunity to come on and talk about Homesteady Health and to just let people know about this great way to receive care. And if you happen to catch this and you're in other states, it's out there. It's all over the country, and I think it's taken off.
I believe in the future, honey, 'cause the future is you and me.
Thanks for listening to the Ithaca Local Economy Lab. If you liked us and want to hear more, please be sure to share, rate, review, and subscribe so you don't miss a single episode. It's noisy in the podcast world, and we need you to help us find more listeners. You can read the show notes, get on our mailing list, and download your own free copy of Practical Resources for Healthcare Beyond Insurance at ithacalocal.economylab.com. And if you know of a local business, nonprofit, or program that you'd like to hear on the show, please send them my way. The Ithaca Local Economy Lab is produced by Practically Real LLC and brought to life by an amazing team, including technical advisor Jake Gribshaw, associate producer Stacey Cornelius, content strategist Sonia Simone, and creative advisor Aaron O'Shaughnessy. Jan Ospina is our artist, and the music is by Carsey Blanton. Until next time, take good care.